Hi everyone, my name is Italo. Welcome to Medicine Podcast. So I'm host Italo, and today we're exploring the other side of medicine in US that most people don't see or don't talk about. I invited Julia to this and if you like this conversation, don't forget to subscribe and stay updated for the next episode. So, Julia, I'm here with the good guest, and really nice to meet you. And can you introduce yourself? And let's start this good podcast, and that will, I think, a shine of the mindsets of the most of the doctors. So,
Hi, Idil. It's very nice to meet you. Thank you so much for inviting me to participate in your podcast. My name is Yulia. I am an assistant professor of medicine in Eastern Virginia Medical School, which just got merged with Old Dominion University. So I work basically as a faculty in Virginia in the United States. I finished medical residency in the US 2024, which I joined in 2021. Before that, I did my education in Russia. So I passed my USMLE exam, got ECFMG certified, joined US residency, and then now, by the end of it, instead of going for fellowship, I decided to work in a as a faculty for a little bit to explore my career options and just take a pause from continuous education. And here I am.
oh, nice. We have a long journey in US and in Russia also. So,
Yeah, that's true.
so can you go ahead?
No, I just was gonna say that I did have a long journey because after finishing my medical school in Russia, I also did dermatology fellowship or residency. The system is a little bit different over there, but I also did dermatology residency for 2 years, and after that, I joined, internal medicine residency US. So my educational journey took a while.
Nice. So, why did you choose to become a doctor in the US?
That's a very complex question. I decided to be a doctor because I feel like, I mean, my mom told me just to dream about like anyone I could be if I didn't have to earn money. So originally, my idea was like, okay, I get along with people well. I have high emotional intelligence, so I'm gonna go into psychiatry, which is why I decided to join medical school. However, when I did join medical school, I realized that psychiatry is not something I would really go for to, continue pursuing this career for the entire life. So I decided to just be other type of doctor, and at the time, I wasn't sure what I want to do. By the end of my med school, I realized that I do want to pursue education abroad because I felt like the education in Russia had its own flaws and I didn't like the system much. So it was never really about money or, like opportunities. It was more about like the quality of education that US could provide. And I found that in the US, the steps to kind of get your degree certified in there are pretty straightforward. So you have to pass USMLE, you have to get letters of recommendation, and then you have to go through match. So everything seemed transparent. So I decided to pursue career in the US. So I started USMLE preparation on the fifth year of my med school. Passed my USMLE by the end of med school, and then passed step two during my dermatology residency in Russia. And then, unfortunately, all of my clinical rotations got canceled because of the COVID pandemic. So I did telerotation instead and matched into US residency in 2021.
Nice, nice. It's good career. And why you like put your mindset, your mind that why did you give up your fellowship and you became assistant profession in the US? And why did you decide to move?
Yeah, so I mean that's a great question because I am actually an overachiever in terms of career, and my entire life I was aiming towards like the best education, I really wanted to do HEMONC fellowship by the end of residency, and not just I wanted to do it, I did everything in my capacity to achieve that goal. I presented abstracts on multiple conferences, I published a lot of manuscripts. My CV was completely ready to get in fellowship, and I did my clinical rotation at MD Anderson and Harvard Medical School, so I did have good letters as well. However, I don't know how much you're familiar with U.S. Immigration. I came in the U.S. on J-1 visa for physicians, which implies intent. In order to get green card, you have to work undeserved area for 3 years, and then you're going to be eligible for green card in the following year. So basically, upon the end of my residency, I felt like, I'm on a visa which is getting expired every year. I can't really travel much to see my family. I'm so tired of ongoing education because if you think about it, since the age of 17 until the age of 28, I was just, enrolled in some sort of training. I mean, residency is very tough and it drained me out. I felt really burned out by the end of it. And although I felt like, everyone was going into fellowship, like everyone who had the same mindset as I did was going into fellowship and, everyone was matching into good, fancy academic places, I felt like if I do join fellowship and I really wanted to do, like top fellowship or some academic place, I'm going to get wrapped up in something that is going to keep consuming my life. And I felt like for so many years, I kept sacrificing so many things like seeing my family, traveling, spending time with my friends, so on and so forth. And now, again, I'm getting wrapped up into something that's going to be even more time consuming and which is going to imply possibly some academic career, which is very intense. I felt like, you know, I can do this. I can prove the entire world that I'm so cool and I'm so great and I'm so smart. And I did that. The cost of it is too high. The cost of it is my mental health, my quality time with, with my family. I mean, I felt like I really need to get secured in terms of like green card and, citizenship sort of in the US because being on a visa, it's very stressful, especially right now. I decided to turn around. I made that decision after I came back from MD Anderson because I felt like people are really busy over there, and I felt like people are sacrificing a lot in order to stay in academic environment. So I came back from this rotation and I decided to start a job search. Unfortunately, I was able to find an awesome position. I love my job as an assistant professor of medicine. I basically work as a full-time clinical faculty. I also have some protected time for research. So I work with residents full-time. I teach them. And this is just a perfect opportunity for me to, pause for a second because 7 on, 7 off schedule does allow me to travel, get rest. I do continue research, which will allow me to continue my education further on if I'm still willing to pursue my fellowship. And it just kind of gives me time to decompress, work on my mental and physical health, and just realize what I really want to do with my future. Because I feel like education is not time sensitive, and you can do it at any point of your life, as opposed to other things that I mentioned earlier.
Yes, nice. This great point of view, I think so. So if you talking about like a three positive things in the US and three negative things about to be doctor in US. So what is your opinion about this?
Okay, so I'll start with positives. So number is I would say that a number is a schedule flexibility. Like I mentioned before, I work 7 on, 7 off schedule as a internal medicine doctor. Of course, this is not something that is possible for every specialty, but for internal medicine in particular, you can work 7 on, 7 off, or 14 on, 14 off. And I've never heard about such a system anywhere else in the world. So it literally gives you, a lot of flexibility to travel, to do something else besides medicine. And it's like having a vacation every other week, to be honest. Number two is obviously salary. Doctors are paid well in the US, although it takes a long time to get there. Once you start earning money, you feel pretty comfortable. Number three, I would say it's an opportunity to practice best medicine, like evidence based medicine, because I feel like, I mean, being educated in Russia, I felt like sometimes things were more traditional as opposed to evidence based sometimes. Some of the treatment plans were based experience rather than novel clinical trials and guidelines. I feel like in the US you have access to novel therapies and treatment approaches, which is great. It's just gonna make you feel, it just makes you feel like a good doctor, that you're doing the best you can for your patients. So those are top three things I would mention. All right, let's do the downsides of being a doctor in the US. I would say that number one, I mean, I feel like becoming a doctor in the US, if you were born in the US, is not the best investment because like I was saying, it takes a lot of time to get there. And although you do earn good money, you start earning so late. And a lot of people do end up with the physician loan, which can be, up to hundreds $1,000, right? By the time this is paid off and by the time you start earning money, I feel like you're behind everyone else who started earning money in their early 20s. And you sacrificed a lot, not just the money but also lifestyle, quality time, so on and so forth. So that's a big downside. Number two, I would say training takes a lot of time and it's just very hard to get trained in the US. Med school, USMLE, residency, it's a very tough work. Did dermatology residency in Russia, so it's really hard to compare because dermatology and internal medicine are completely different. But I do talk to people who studied in Russia. I just want to say that in the US, hours of work are much, much, you just work more, you work harder, you become more kind of responsible by the time you're a resident. So I feel like not everyone could survive this. I mean, they could, but the price of it can be like your mental health, your physical health, and things like that. Number three, let me see. Two, I feel like in the US, although you do have liability insurance and your hospital does protect you, the amount of lawsuits that doctors are getting, especially in certain specialties such as surgery, OBGYN, emergency medicine, the rates of those are pretty high. Being doctor in the US, I would say might be a little more stressful because it's really easy to sue the doctor, I feel like. Although I'm not gonna pretend to be an expert because I might get hate for it because I don't know how things exactly work in different countries. But I feel like over here, it's very common for patients to advertise for themselves, which is great. Like as a patient, that's a great opportunity, but it's also stressful for the doctor because they are responsible for a lot of things and they have to not only care about how they treat people, but also like how they talk to them, of things that are not as prominent in other countries, say, if that makes sense.
Yeah, that's very tough. Do you think that the doctor in the US, if you compare to Russia, like the doctor is less powerful? Like, I mean, like the doctor, like always work in a big hospital in the big country, not big country, but in the big hospital, and the hospital like have like a strict rules about the dogs, and we need to just follow strictly hold this company. Are you agree about that? I think it's not. It depends of the hospital that you are.
I honestly cannot completely agree with that because, like, even in Russia, you have a lot of constraints actually. Like, maybe you're not gonna get sued because the culture is just different. But I feel like you are actually under more pressure in developing countries compared to here. Over here, like as long as you can justify your actions, as long as there's a study or a protocol that justifies what you do have some flexibility around that. What I mean is that, like, if you want to treat patient according to the novel clinic, you do not necessarily have to follow the guidelines as long as you have good reference. In Russia, like I was saying, things tend to be more traditional and sometimes you're just not allowed, you just do not have that flexibility, putting like setting alone the fact that you don't really have access to novel therapies and like things like that. So I feel like doctors here are pretty powerful. It's just you got to learn how to work in that system because it has its own rules, but as you do get comfortable with it during residence. So I feel like I actually feel more powerful here compared to Russia.
Yeah. So, in your opinion, like nowadays, what's the big reason like a doctor are quitting medicine in US? I saw some research about a lot of doctors are quitting in medicine in nowadays. What do you think is the big reason like the doctors getting out of medicine nowadays?
That's a great question. Quality of life of medical doctors has been a big concern in general for the past decades, and there is like annual report on that in terms of like how doctors evaluate their own quality of life. And I feel like actually right now it's going uphill. So according to the most reports, the majority of doctors actually define their quality of life as like over 50%, which is dramatic improvement from before. Like previously, the amount of burnout was to the roof. But I feel like the majority of reasons are related to burnout because doctors are getting more and more responsibilities. The amount of patients you have to take care of, it's increasing. And although doctor salaries in the US are pretty much the only salaries that are exceeding the inflation rate, I feel like the reimbursement went down if you compare it to, you know, like 30, 40 years ago. So a lot of people do feel frustrated that the amount of responsibility, the amount of mental pressure, the amount of interactions with humans that you have to do, and like, you know, mental tasks that you have to complete during the day doesn't get matched with the amount you're getting paid. And then, you know, like, yeah, work hours, a lot of sacrifice. So I feel like a lot of physicians, once they start earning money, they do explore physician side gigs, and they try to invest into real estate and do it quicker so they can become financially independent and go outside of medicine, because a lot of people just get burned out and they want to do something besides that just to get this mental pressure off their shoulders. That's my opinion. But again, I don't know. I just started practicing. I'm 29, so who knows? Maybe there is something else.
That's a great point of view. And you think like older careers that you should advise to someone go to the fellowship like you? What's the older like if you describe like a three careers that possible in US, exception for be a tenant, be a teacher for in medicine. What's the older career you recommend to someone?
Yeah, I just want to start with saying that I feel like anyone who really wants to go into fellowship should go into fellowship. But I think like the biggest motivation must be, I really want to be a cardiologist. Like I cannot see myself anything else but a cardiologist. And if that's the case, go for it. So your only motivation has to be, you know, your desire to become certain specialist, not the money, not the prestige of it, not the, you know, yeah, the prestige I would say is the main thing. You just have to answer this question in your heart, that you're not happy to be where you are and you just want to get through that degree to become happy. That's the only reason to do fellowship, in my opinion. Now, if you want to pursue something different and kind of give your time to explore your options, the, you know, the main pathways after completing internal medicine residency in particular, like number one, becoming attending, so full faculty, which has its own downsides because you're getting paid less compared to hospitalists, but you have more free time and you have this teaching opportunity and so on and so forth. You can become a traditional hospitalist, which is like taking care of your patients independently. The schedule usually allows you to have more days off compared to teaching attending, but there are more responsibilities. Like once you're working harder compared to teaching faculty because you have to do everything on your own and, you know, answer nurses, put all the orders in, updating families. When you're a faculty, obviously residents take a lot of work and do it by themselves. There is a combined option where you can combine, you know, assistant professor of medicine, aka teaching faculty, and hospitalist position, kind of a hybrid model where you would work as a hospitalist, let's say 50% of the year or 60% of the year, and the rest of it is going to be a teaching attending. And then I just realized that I'm talking too fast and you just asked me to be slower, so I'm going to try to slow down. And the last thing is to be outpatient practitioners, basically primary care physician, where you work business hours, usually from 8 to 4 or to 5, and you have weekends off. And however, that does not allow you to have this, you know, 7 on 7 off schedule. You just have normal people vacation time, which is like 6 to 8 weeks a year.
Nice, nice. So this is good point of view, and this is good. Like you have more pathways than if you be a fellowship for sure. This is the not only way to be a doctor specializing and stay US for the doctor too. So Julia, thank you so much for your attention. Thank you so much for a great conversation. This is really nice to hear like the older side of the US and be a doctor in the US that we don't have only the pathway to follow. So they're really nice to hear your history and see you in the next time. Thank you so much for your attention.
Thank you so much for inviting me. It's been my pleasure. Yeah, invite me again. I'm looking forward to.
Yeah, thank you so
All right. Bye bye.